So welcome everybody to today's event. Let's talk about it, undoing the stigma around vulva and vaginal health. My name is Tori Ford and I'm the founder of Medical Herstory, and I'm so excited to be hosting today's event with you all. So before we begin, we like to have a land acknowledgement. So Medical Herstory is based in Tiohtià:ke, Montreal, and many of our events and operations are located on land which has long served as a site of meeting and exchange amongst Indigenous people, including the Kanien'kehá:ka of the Haudenosaunee Confederacy, Huron-Wendat, Abenaki, and Anishinaabe nations. Medical Herstory recognizes and respects these groups as the traditional stewards of the lands and waters on which many of us are today. We cannot begin to discuss patient advocacy, barriers to accessing care, or internalized stigma without recognizing the role that colonization, white supremacy, and medical racism play in the social structures which healthcare as an institution is situated in. Today, this event is all about vulva and vaginal health and undoing the stigma that surrounds it. We're aiming to visibilize the experiences of the millions of people around the world whose lives have been affected by these conditions and rendered invisible by both mainstream media and medical research. People living with vulvovaginal and pelvic pain might often find themselves experiencing shame and stigma. And through this event and the stories shared by our wonderful panelists, we're hoping to raise awareness and start a dialogue about invisible pain and chronic illness. And where I'm coming from is Medical Herstory. We are an international award-winning not-for-profit on a mission to eliminate sexism, shame, and stigma from health experiences. We advocate for gender health equity through medical education, patient support, and medical education. We hold a range of events like this one, workshops, publish stories, and run media campaigns. And this event today is actually very close to my heart. For those of you who don't know, I started Medical Herstory out of years of living with chronic yeast infections and facing so much medical dismissal. You know, being told that wearing white underwear would be the problem, was the sort of the problem that was causing my chronic pain, or being told dismissing words like some people get colds, some people get chronic yeast infections, or maybe that it was all in my head or that I should just take some time off school. And I know that a lot of you in the audience today, those words are going to ring true for you for things that you've been told from medical professionals or from other people in your lives. And today we are going to be undoing that stigma and advocating for change within this space. So I'm really excited about that. You can find Medical Herstory on any social media. And today we are so excited to be partnering with an amazing wellness brand, Marlow, who's going to be introducing a bit about their product. And we have a giveaway at the end. So we're so thankful that they are sponsoring us today. And I'll pass it over to their representative now.
Good morning, everyone. Thank you, Tori, for hosting this event, and everyone at the team at Medical Herstory and all the speakers. We're really excited to be here today. My name is Nadia. I'm one of the co-founders of Marlow, and I'm here with Kiara, who is one of my other co-founders, and she's going to be sharing a bit more about our product towards the end of the event at the giveaway. And so Marlow started just actually as a conversation amongst our team as friends. We were all friends before starting Marlow. And my co-founder shared that she had a lot of pain when inserting a tampon. And she's a very active individual. She loves to swim, she loves to play sports, and a lot of the things that tampons allow us to do while on our period. And because tampons were so painful to insert, she wasn't able to live that active lifestyle while on her period. And we believed that everyone has their own product preferences and they should be able to use whatever product it is that they prefer and not be limited by other factors or barriers in their life. And so my co-founder had gone to the gynecologist to try to find a solution to the pain she was experiencing. And the gynecologist told her to spit on her tampon. And that shock factor just blew away our team. We thought there must be other solutions out there that could also help with this problem. And so that's what inspired us to create the first ever tampon and lubricant designed to be used together. And so Kiara is going to be sharing a bit more about that product towards the end of the event. So stay tuned and she'll kind of show the product as well. But beyond our product, we're also really passionate about education and reducing the stigma around this space. So it's really exciting to be able to do an event like this with Medical Herstory to be able to further that educational mission and reduce some of the stigma around this space. So thanks so much for having us as well. And we're really looking forward to hearing all the speakers.
Amazing. Thank you so much. And next up, we're going to talk a bit about the structure of today. So if you haven't been to one of Medical Herstory's storytelling events before, they run sort of in this setup. So we're going to begin with storytelling sessions. So each of our amazing panelists is going to share a bit about their journey with vulva and vaginal health. We're then going to have a panel where we've prepared some questions that we think are really important around addressing shame and stigma, medical experiences, and patient communities. We then are going to have an open Q&A where you all can have your burning questions answered. And at the end, like we just hinted at, we have a giveaway with Marlow's amazing products. We also have donations from Smile Makers, which is a great sex toy company all about vulva health. And Medical Herstory also has some of our great merch to give away. So definitely stick around to the end to be eligible to win some of those prizes. So one of my colleagues is going to drop this in the chat now. Throughout the event, if you have any questions, we encourage you to submit them through menti.com. And this is the question bank that we'll be drawing on at the end of the event. So you can type your question to ask any speakers and feel free to put your name on it. Or if you'd rather be anonymous, that's totally up to you as well. So a few Zoom rules or housekeeping. Please remain muted if you are not speaking, but if you're comfortable, we really encourage you to keep your cameras on. We love seeing our community. Feel free to use the chat throughout the event. We love talking with all the participants. Let us know what you're thinking and feeling. You know, when something hits you hard or you relate to it, make sure you let us know. And if at any point, you know, you're feeling uncomfortable, something may be a little too sensitive for you, anything like that, we do have active listeners present. They will type their names in the chat. They work with Medical Herstory and our trauma-informed team. So they're there for any support that you may need. And of course, today, as with all Medical Herstory events, we're going to be respectful to everybody and know that people are speaking from lived experience and that nobody is, here to represent an entire community or the entire experiences of everybody, but instead talking about what they've been through. And finally, we have closed captions enabled, so those should be accessible to everybody. But if there's anything else we can do throughout the event to make it more accessible, or if anybody's having trouble with the Menti or anything else, you can just message me directly and I can help solve that for you. So just before we hand it over to our speakers, I just want to give a slight content warning that today we're going to be discussing heavy topics that include discussions of sexism, racism, ableism, medical trauma, mental health, and other sensitive subjects. So Medical Herstory recognizes that these topics can be challenging, and we are so grateful for our speakers for sharing their knowledge and experiences both today and continuously through social media. But we just want to be mindful for our audience members to please, practice self-care, take breaks, all of that as needed, and remember that we do have active listeners present. And with that, I'm going to hand it over to my amazing co-host, Alessia, who is Medical Herstory's Director of Events, to introduce the speakers for today.
Hey everyone, thank you for joining us for this event. My name is Alessia. I'm the Director of Events at Medical Herstory, and I will now present to you the speakers for today. So we have Junhan from the Black Broken Anxious podcast. We have Michelle, who you may know as the Happy Pelvis on social media. We have Keisha, who has a blog that is named The Chronic Diary. We have Noah from the Tightlip podcast, Rosie, on Instagram is Vaginismus Who, and Lydia Louise, who is Vulvodynia on social media. So starting off with Junan, Junan was diagnosed with PCOS when she was 17, but she had symptoms for 14 years. Following an incident that occurred during a heavy period, she decided to look further into her diagnosis, and she found out that the symptoms that she had been living with, both mentally and physically, were not her fault, but they were a consequence of PCOS. PCOS is described as a gynecological problem with chances of infertility, but she wasn't aware that that may affect on so much more than just like that. So Junan has now made it her mantra to help raise awareness about PCOS via a podcast that is Black Broken Anxious. I will now pass it on to Junhan, who is gonna tell us a little bit about her story.
Okay. Hello, everyone. My name is Junan, and I am the creator and host of the Black Broken Anxious podcast. PCOS stands for, I saw someone asking the chat, PCOS stands for Polycystic Ovarian Syndrome. So that makes it clear. So my story is a very long one. I'm currently 30 something. I don't like to give my age, but so I'm currently 30 something. So when I first started, my period was about 11, and I noticed that I was getting really sharp pains before my period would start. Come to now know it's ovulation pain. And I kind of didn't really discuss it. I thought, oh, maybe it's just something that everyone goes through, so I'm just going to leave it and just carry on with my life. But as I got older, it started to become more debilitating, more painful. And I think I got to the age of 17 where I then decided to go to the doctor and ask for help and just say, well, can we look into it? Because I don't know what's going on. So I'm going to hit my diagnosis story in another part of the event. But however, I was diagnosed with PCOS. Polycystic ovarian syndrome. At the time, I had a couple of cysts on my ovaries, and I was told by the doctor, well, you may not be able to have children, but we don't know unless you try. So come back later and we'll look into it. So I was like, okay. And well, she gave me a pamphlet and I was on my way. So for years, I had been living with symptoms, not knowing it came from PCOS. And these symptoms are like insulin resistance, not being able to lose weight very easily. I had skin problems, like I had dark patches on my skin. Another one is I had really thin hair. Also, I had a lot of symptoms that derive from mental health. So I've had depression and anxiety, and I love a lot of a plethora of symptoms that at the time I just thought was myself. I didn't really realize it was from PCOS. And it's only until literally 2 years ago, 2020, when the fateful pandemic started, and we were all on lockdown, and I was going through a really bad, my third bout of depression. And that's where I saw something on Instagram saying PCOS, and I had never seen PCOS in social media before. So what I came to realize is that PCOS is not just a gynecological disorder that we are diagnosed with that affects our fertility. PCOS is actually an endocrine disorder and hormonal disorder and a chronic disorder that affects our whole being. And it stretches as far as a symptom of PCOS, or something that PCOS can contribute to is dry eyes. And so when I started to kind of look into PCOS and look into the symptoms and so forth, I kind of started to realize that, oh, well, all these symptoms is not because of me. So for years I had made me feel like it was my fault. It's my fault while I'm not losing weight. It's my fault while my hair's not thin. It's my fault while I'm craving really sugary and bad foods for me. It's my fault I'm going through this, not knowing that these are all symptoms of polycystic ovarian syndrome, and it is a hormonal disorder. So when I started to look into it even more, I started to realize that there must be a lot of people out there in my position with my symptoms, not realizing that it comes from something. And what I've come to realize is, while I was researching PCOS, there's not that much awareness about it. And I kind of came to the conclusion that if I'm not aware and I've actually been diagnosed, what about people out there who look like me, are going through the same things as me, and just don't know what's going on? So I kind of started my Instagram page, Black Broken Anxious, and then I started my podcast, Black Broken Anxious. And I started my podcast to raise awareness about polycystic ovarian syndrome, not just for like everyone in general, but especially for people who look like me. Because what I noticed as I was going through social media, that a lot of people that at the time that were talking about PCOS didn't look like me, couldn't relate to me culturally, couldn't relate to my background. And I wanted to start a platform to promote people who look like me, to let other people know that we are here and we also have PCOS, polycystic ovarian syndrome, and also kind of let people know that if you're having symptoms and you think there's something wrong, go to the doctor. Do not feel scared to go to the doctor and explain your reasons. So I started Black Broken Anxious podcast, and I've had a really good reception. I've had guests come on and talk about their stories. We've talked about certain topics like what topics have we saw? Hair loss. I've also had topics about brain fog, which is something that I really suffer from, as you can see. And we've also had people come on and talk about extra facial hair, because that's another major symptom of PCOS. Not everyone get it, but there are people out there that do live with it and it does hit them hard. And yeah, so I want to continue to create a community where we can just raise awareness more about PCOS. So guys, thank you for introducing me or inviting me to speak here. And I hope that there's some people out there that could relate to me and decide to go to their doctors and decide to look into their health. So yeah.
Thank you so much for sharing your story, Jonan. It was very nice. So we will move on to our next speaker, who is Michelle. Michelle is a 32-year-old pelvic health advocate that lives just outside of Toronto, Canada. Her bladder and pelvic pain symptoms were dismissed and misdiagnosed for years until the pain became so overbearing that she began to research herself. And right now, Michelle is a full-time chronic pain patient, but also the founder of the Happy Pelvis, which is an online blog and platform that aims to educate and spread pelvic health awareness. So I'll pass it on to Michelle, and we're ready to hear your story.
Hi, everybody. It's great to be here, and I'm happy to be among others who know exactly the emotions and the pain that I've personally felt for a very long time. So like June-Ann, my journey is pretty long, so I'm going to try to condense it down a little bit. So first, I started having pelvic pain as a child. I fell off the back of a toboggan and I had tailbone pain that never really went away. And then I was susceptible to chronic UTIs and chronic chronic yeast infections. And that started probably in my early teens, like 12, 13 years old. And my family doctor tried his best to try to help me to figure out what was going on. I tried multiple creams, suppositories. I tried everything, and it got to the point where my vulva was very sore, raw, inflamed. There was a lot going on. No treatment that my family doctor prescribed was helping. So I was then sent to see an OBGYN when I was 15, 16 years old. And at that point, they gave me the diagnosis of Vulvodynia, as well as Vulvodynia and possible lichen sclerosis. So I was then sent to a vulva dermatologist who took a look at my condition, and she believed that it possibly could be lichen sclerosis. I have a family history of autoimmune conditions like lupus. I also suffer from lupus as well. So everything was sort of making sense at that point, but that doctor never took a biopsy to confirm that diagnosis because she was concerned about me having more pelvic pain in the future. And at that point, I was frustrated and angry, and I'm like, why can't you just do it? But now looking back and understanding chronic pain and chronic pelvic pain a little bit more, I believe she was looking out for my best interests because she understood what can happen down the line. So she said, stop all of the creams and suppositories and everything that your family doctor has given you. Try clobetasol, which is a medication for lichen sclerosis. If you don't know, lichen sclerosis is an autoimmune skin condition of the vulva and also the anal area as well. So at that point, given the Vulvodynia diagnosis and the lichen sclerosis diagnosis, I was given no direction. I was told it was just something I would have to live with. And there were numbing creams that I could use to help with the pain, with sitting, with intercourse, with all of that. I remember going home and searching. So I am 32 now. At this point, I'm 15, 16. This was the start of, I don't know, AOL Messenger, MSN Messenger, and all of that good stuff. And Google. And I searched lichen sclerosis, and a lot of scary, intimidating information came up, like my vulva was going to shrink and I will never have intercourse. And there was just a lot of intimidating information. So on top of all of this, I started the birth control pill. So I was put on the birth control pill to help my debilitating, painful, heavy periods. So I suffered in silence in dealing with my own vulvar pain. Well into my 20s, I pushed through. I suffered in silence, as we say. I never really spoke about it to my partners. It was something I kept to myself. However, the times that I did, it led to a lot of discomfort and frustration because my doctors would there'd be a lot of biases at play, and my doctors would sort of put me in a position that made me assume that my partners were cheating, and I would have to do another an STI test. Those growing up between 15 and 25, telling your practitioners that you're honest, like I've been with my partner for X amount of time, and them still doubting you and putting that doubt into your mind that your partner is not staying faithful and everything, and still thinking that you're dirty and you're coming in for another like sexual transmitted disease or infection test. And so I sort of, I didn't tell anybody. I sucked it up. I pushed through, as they would say. And then in 2017, when I was about 27, 28, my health started to deteriorate. And it was actually, unfortunately, an UTI who really tipped that scale for me. And my health really went downhill from there. And I began to take it upon myself and advocate and learn about these pelvic health conditions. So at this point, when I went to go see my doctors in agony at 27 years old, frustrated with the system and frustrated with not getting answers for so long, I was told about pelvic floor physical therapy. That is something that I know I could have benefited from at 15, and at 27, it was a big eye-opener and a big shift in how I see and felt about my pelvic pain, because like Junan said earlier, there is a lot of blame. It was all my fault that I was getting these UTIs. And Tori earlier was talking about white underwear. How many times I was told to wipe from front to back, like as if I was a child not knowing how to clean myself using the bathroom, or also being told about wear white underwear, don't wear thongs, wear cotton, 100% cotton underwear. And I would always think it was my doing for causing my pain. So when in 2017, when I began to advocate for myself, I noticed that there wasn't really a community or an outlet for people like me. And when I did start doing my research, I started noticing there was a lot more people suffering in silence like I was. And So I wanted to create something that a younger self would look at and be able to relate to, resonate with, get education, bring it to their doctors and help them on their journey. So that is why I created the Happy Pelvis. So right now it's a platform, an online blog, and it aims to create more education and awareness around pelvic health and pelvic pain conditions for Canadians and for anyone around the world. So it's been a long journey. I could go on and on and on about a lot of the biases and that I've experienced and a lot of the negative doctors' experiences I've felt. But I just want you all to know that you're not alone. And if you're here, you're taking that first step in really advocating for yourself and really learning that voice that you have within you. So yeah, so thank you so much, medical historian Marlow, for inviting me and for allowing me to share a little bit of my story with you all. And yeah, thank you.
Thank you so much, Michelle. And thank you for sharing your story. And I think that for personal experience and also seeing in the chat, what you said really resonates with a lot of people. I think we all heard the same things. It's all in your mind, just wear white panties and stuff. Moving on to the next speaker, we have Keisha. Keisha is a writer and owner of the Chronic Diary, which is a blog centered around chronic pain and chronic illness. Keisha has been living with chronic pelvic pain for over 6 years, and she has transformed a daily journal that she used to document the highs and lows of her life with chronic pain in a blog. And she hopes that sharing her experience along with lessons that she has learned along the way will help raise awareness and support for those living with chronic pain or chronic condition. So I will pass to you, Keisha, and you can share your story with us.
So yeah, I'm Keisha, I'm from London, as Alessia just said. I'm a blogger. I've got the Chronic Diary, which is a chronic pain blog to kind of help bring awareness and share my experiences and my tips and, you know, all the things that I've learned along the way with living with chronic pelvic pain. So I started the blog after so many years of writing in my journal, documenting my experiences, how angry I was, my symptoms, just kind of a way to kind of vent about my pelvic pain. It was kind of a way for me to just let everything out and just, you know, give people a real insight into what it actually looks like to live with chronic pain, because I think people think it's one thing, which it definitely isn't. So yeah, my journey with pelvic pain, it's been rough. The pain started when I was about 22, and it just never went away. So prior to being in pain, I'd never even really had bad periods. I was pretty healthy. I just wanted to be your average uni student, partying, pretending I'm listening to lectures and stuff like that. So, you know, having no health issues or pain like this before, it was like a really big shock to the system. I was like, what the hell is this? I don't know what's going on. And for such a long time, I was so embarrassed about it. I was in denial. I kind of just tried to put it to the back of my head and just put it to the back of my mind. It's not happening. I'll be fine. But it wasn't the case. But I remember clearly turning 24 and it dawned on me like how bad things had really gotten. Like at that stage, I started to go to the doctors. I was being bounced back and forth from different departments, specialists, you name it. I'd been misdiagnosed about 5 times at minimum. I'd had 3 laparoscopies looking for endo, which they couldn't find. I'd been prescribed a long list of medications that I won't even name because we'll be here till tomorrow. And, you know, it was either the side effects were really bad or they were helping at first with the pain and then they stopped helping. It was just hell. And I also noticed, like, going back and forth with the doctors, I was being told so many different things that were making me so upset and angry and just disappointed. I was being told, oh, you know, the pain's in your head. You're too young to be in that much pain. We've done all these tests and these scans, so we can't see anything. So you're fine. You're absolutely fine. And eventually I was told, you know, the pelvic pain has no cause. There's nothing that can be done for you. And that was pretty much it for a long time. And for so long, I was so frustrated, and I just got to the point where I was like, do you know what, I'm just going to accept what they're telling me. I'm just going to try and deal with it on my own. And because, you know, if a doctor tells you something, especially when you haven't been through anything before, we kind of have this idea that, okay, the doctor said you're fine, so that's it, like I must be fine, there's nothing wrong with me. But it was also me kind of giving up at a stage, was kind of like I was so frustrated, and it felt like I was begging people to listen to me, like screaming, but not really, but screaming in my head, like, please, like, help me. I don't know what to do. But, you know, after a while, trying to cope with the pain, it just wasn't viable. Like, in every area of my life, things were just getting worse because of the pain. And, you know, my periods were absolute hell. I started to get severe back pain, pins and needles in my legs, nausea, pain going to the toilet, pain when I did everything. Like, you know, it was really hard, and I got quite depressed, and I'd been fired or had to leave a few jobs because I was constantly off sick, and I couldn't explain to my employers why, because I didn't know why. I was like, what the hell, I don't know how to explain this to people. And you know, it was just really hard because I didn't know what the hell was going on. And it just got to the point where after a long time, I just said, you know what, enough is enough. I'm not taking no for an answer. I'm putting on my war gear. Let's go to war, because I'm going to get an answer or something. I was no longer willing to accept, oh, you know, try yoga or CBT or things that are not long-term solutions or help. And I was just going to get some answers. So it was whether if I got a diagnosis or something that would just help me manage the pain, I had to get something. So I kind of started to do my own research, and I started to ask more questions. I went to the doctors with my notebook, my pen, my questions written out all neatly. And I really just started to become more comfortable and confident advocating for myself, which it was really hard. Don't get me wrong. Half of the time I had my notebook and my pen, my hands were shaking, I was sweating, I was an absolute mess. I wanted to scream inside because I'm thinking like, oh my gosh, I'm challenging the doctor. Like, who the hell do I think I am? But I really had to do it. And I feel like doing that, it got me to the point where I'm at now, which from 22 up until now, I'm nearly 30, I received a diagnosis last year of chronic pelvic pain syndrome. And, you know, things are still hard. It doesn't mean because I've got a diagnosis that the pain has disappeared. It's definitely still there, and it's there to stay. But I just feel like having that diagnosis, I have a lot more options, and I can research a bit more and understand a bit more of the things that will help me manage the pain better for now. And you know, all that I've gone through over the years, it just made me realize that, oh my gosh, so many people must be going through the same or similar experiences to me. And you know, also interacting from different people within the chronic illness and the chronic pain community, I realized that, girl, you are not a unicorn. There's so many people that we're going through the same struggles, and we're just not being heard, we're being pushed to the side. Which is why I started the Chronic Diary, to kind of try and share my experiences, things I've learned along the way, and try and help people not go through the things that I've been through so far. And I also think that it's really important to let people know and try and give them tips and support, and kind of build their confidence to understand that it's okay and you need to advocate for yourself. Because unfortunately, those of us, as we know, that have pelvic pain and all these different conditions, we're often ignored or pushed to the side and put to the back of the queue. So I feel like with amazing events like these and talking about these things, like, I'm starting to see a real change which needs to happen. So yeah, I'm really happy to be here. So yeah, that's me in a nutshell. There's so much more I could say, but I won't, because we'll be here till next month. So yeah, that's me.
Thank you so much, Keisha, for telling us your story. And I think I'm gonna, I have this thing that I write phrases on Post-its when I have too much pelvic pain. I think I'm gonna write, "You're not a unicorn." It's gonna be my new favorite phrase. It's amazing. Yeah, thank you so much. And moving on to our next speaker, who is Noah. Noah is the executive director of Tightlip, which is a grassroots storytelling and advocacy organization by and for people with chronic vulvovaginal and pelvic pain conditions. Tightlip is born out of Noah's personal experience with pelvic floor dysfunction, and she has created written and audio pieces about chronic vulvovaginal and pelvic pain in order to stigmatize this condition and build a community of patient advocates. She has co-founded the Tightlip podcast, a curated storytelling show that features honest and compelling personal narratives alongside analysis from medical professionals and academics. So Noah, we are very happy to hear your story, so I'll pass it on to you.
Thank you. Yeah, this event is really amazing. Keisha, I really appreciated hearing you just now and resonated with basically every single thing that you said, and feel that way about all of these stories. It's like, it's incredibly, it's like both heartwarming, but also like it gives me a lot of anger to hear just all of the patterns and everybody's experiences, because I think that really points to some of the much deeper systemic issues in how the healthcare system in all of our countries and wherever you are treat chronic pelvic pain and treat vaginal pain and treat many of these conditions. So similar in some ways to some people's experiences, my whole life I had had pain with tampons, pain with pelvic exams. Nothing had ever been able to go inside of my vagina. I had always felt like there was something wrong with me. When I first went to get a pelvic exam and I went to the gynecologist when I was about maybe 18 or 19, she tried to do an exam and I couldn't handle it. It was too painful. It felt physically impossible. And she said, okay, it's because you're nervous and anxious. How about I give you some sedatives, some like sedation medication, it will calm you down and then you can come back. I left the office. I didn't go back for 3 years. I was like, what? I'm not doing that. Like, that sounds scary. I don't want to drug myself to get a pelvic exam. But a few years later, after many attempts to try to have penetrative sex, to try to use tampons, and feeling that every time I was just in excruciating pain, it felt like totally impossible. I was like, okay, it's time to go back to the gynecologist. I took the sedatives, took these pills to make myself calm down. I went in, I was feeling really happy, loopy, really good. And I was like, this will be easy. She'll just do the exam and we'll be done. That's not what happened. She tried to do the exam. It was the same thing that I'd always experienced. It was incredibly painful. It did not feel like it was possible. And she was like, okay, it's because you didn't take enough of the medication. You must still just be too nervous. How about you go under anesthesia at the hospital and we'll do your pelvic exam and pap smear. So I spent the day at the hospital. I went under anesthesia to get a routine pap smear and pelvic exam. And I was kind of expecting them to find something really wild inside of me and discover that, okay, your vagina is a really weird shape, or I don't know, there was something really, really strange. And when I woke up, she was like, great job. You got your pap smear, you got your pelvic exam, everything looks normal, you can go home. And I was like, well, wait a second, what are you talking about? I just spent the day at the hospital. I'm waking up from a pelvic exam, which is something people are supposed to be able to get in 2 seconds and then go home. That doesn't really seem normal to me. And she was like, it's good. You got your pap smear. There's nothing else you need to do. So that kind of started me off on this journey of okay, the gynecologist, which is I feel like for most people, kind of your go-to person of who you go to if you think something is going on with my vulva or my vagina or something, that should be the person who can give me the answers of what to do. She was not helpful. And she didn't think there was anything wrong, which also for me, as someone who is already I've never heard of anything like this. I've never heard of this happening to anyone else. The fact that she was kind of validating that idea and was yeah, there's nothing wrong with you. You're just nervous about the pelvic exam. I think even kind of further entrenched for me that okay, this must be all in my head. Maybe I'm making this up. Maybe it's not real. So that kept happening to me. When I went to my primary care physician and was like, I can't have penetrative sex. It's too painful. What should I do? Her reaction was, are you sure your boyfriend knows what he's doing? Clearly you're just having sex wrong, or you're doing something wrong. So after a lot of those experiences, I think for me, a big piece of kind of where I landed in my experience was up until that point, I hadn't told anybody about what I was experiencing. It felt like the most shameful thing you could ever tell someone. Like, how do you tell someone, like, I can't use tampons, which are like, I don't know, people use tampons when they're 11 years old. Like, that seems like a basic thing that people could do. Or like, how do you tell people you can't have penetrative sex, or you can't get a pelvic exam? Like, I think there was something about that just felt like I didn't even have language for it. I didn't know how to describe it. I couldn't even, like, even the word pain, like, I couldn't figure out how to say it. I couldn't figure out how to describe what I was going through. And I had never heard of anybody else. I mean, the fact that, you know, a few years ago, my younger self sitting at an event like this would be like, are you kidding me? There's all these people around the world going through something similar. Like, I just thought I'm literally the only person in the entire universe who's ever experienced something like this. I thought that I was like, you know, I was the only person who'd ever gone through this. There was no representation. I never seen it in TV. I never read a book about someone who had vaginal pain. And I think for me, the like experience of going from doctor to doctor and getting dismissed got me angrier and angrier to a point where I was like, okay, I'm going to tell people about this. And I started kind of trying it out. I would like try out different language, try different ways of saying it. And as I started talking to more and more people, I got the same reaction, which was, oh my God, my friend has that, or my cousin has that, or my, you know, sister's best friend, this person. Everybody knew someone else who had vaginal pain. And it's not that everyone had like the same condition. Like, some people had a lot of the experiences we've heard about on this call so far, like chronic UTI symptoms, chronic yeast infections, pain with sitting, pain with pants, chronic itching. I think a lot of people had like various different experiences, and my particular experiences provoked pain. So pain that's only with like tampons or pelvic exams or sex for the most part. And it was totally shocking to me to discover that there were all these other people all over, like not just all over the world, but also within my community. I think the most shocking experience for me was when I finally started to get various different diagnoses. I've gotten the question of like, what's your diagnosis is hard for me, because I think every doctor I go to gives me a different diagnosis. And then it's like, you have to, I think a lot of people probably have this experience. You have to kind of decide which doctor, whose diagnosis are you going to go with? So I've had vulvodynia, I've had hypertonic pelvic floor dysfunction, I've had an abnormal hymen. I won't go into that now, but I had a hymenectomy. I've had a lot of different diagnoses. And for me, though, like one of the most shocking experiences was when I finally got to pelvic floor physical therapy, which I think is what has been most helpful to me so far in my journey. I was talking to my best friend from elementary school, like someone I grew up with, about it. And it turned out she was seeing the same pelvic floor physical therapist that I was. Like like the person I've known the longest, who I was like childhood best friends with, literally was going to the same doctor as me, but the like shame and stigma that I felt was so strong that I would never have discovered that like years before, when we were going through kind of like the same experience. So there's so much to talk about here, but I think that like the biggest thing for me that shifted was not just like getting a diagnosis. I think to some extent was helpful, but was more this understanding of, okay, if this is all around me, but everyone's being silent about it, like what's actually happening here, and what are some of the deeper systemic issues in our healthcare system that are both leading us all to believe that like we're all alone, or that it's all in your head, or that it's not real, and leading so many people to go from doctor to doctor to doctor and struggle to get a diagnosis or struggle to get treatment and care. And for me, like both the storytelling of it was really useful, but also when I started to do my own research, similar to other people here, I discovered some studies that have shown that chronic vulvar pain is actually occurs in 10 to 28% of women or people with vaginas, which is like 28%. That's like 1 in 4. So that, I think that just like the understanding of how prevalent it is and how common it is, and the fact that like so many people are silently going through the same thing that you are, has been incredibly, I mean, really like has changed everything about my life and how I understand my body, and has also led us to start Tightlip, which I can talk more about, but at another point.
Thank you so much for sharing, Noah. And I think that what comes from your story is that we all felt very lonely at one point, but we didn't understand there's so many people suffering from the same things or similar symptoms. So we will move on to the next speaker, which is Rosie. Rosie has several years of lived experience with vaginismus. One day she made an Instagram account, which is Vaginismus Who, in an attempt to connect and chat with others about it. But most importantly, she was very passionate about normalizing the talk around vaginismus. She was sick of the shame, the embarrassment, and the lack of conversation about a condition that affects so many of us. And finding a community of people has truly changed the course of her journey with vaginismus, from something that was frantic, desperate, and filled with frustration to something a little bit more mindful, loving, and open. So Rosie, if you want to share your story with us.
Hi, everyone. Firstly, thank you so much for inviting me and having me. Noah, I literally can resonate with every single word that you just said. It really is amazing how we can all be having, you know, almost identical experiences sometimes, and we just don't know. So this is so powerful. But yeah, so just to introduce myself, my name's Rosie, and I'm from the UK. I live in London, and yeah, I'm going to talk a little bit about my experience with vaginismus, and yeah, I hope it's helpful to someone here. So in case you've not heard of vaginismus before, basically the sort of like medical definition of that is that it's the muscles in the vagina that tighten when you try to penetrate, whether that be with a tampon, a penis, whatever it is. So yeah, I think as Noah just said, that some of the estimates for how many people with vaginas can experience this is so high. Yeah, I've seen figures, you know, almost at 20%, and that's the people we know about as well. And I just think this is a condition that's so linked with shame, and that number could even be higher, because I think there are so many people who might go through their whole life and not say anything at all, and never really be able to sort of go through that. So I first, well, I think I've had vaginismus for all my life. I didn't have a word for it for a really long time. That meant that I had a lot of awkward experiences, a lot of awkward sexual encounters, a lot of failed tampon attempts, you know, and a multitude of other things, you know, medical exams, all those kinds of things. And something that Junan said, which I just really agreed with, is just that you sort of think that it's your fault. It's like, oh, maybe I'm just putting the tampon in wrong. Maybe maybe I really don't know what I'm doing here. Maybe I'm doing sex wrong. You know, what is going on? I've no idea. And, you know, all of this really led me to feel quite a bit of a useless woman in the like in the best terms I can think of. Very broken, very abnormal, and just, you know, not like the experiences I was hearing all my friends talk about, which is, oh, you know, I had sex with this guy at the weekend and it was great, you know, or going swimming and just being able to put a tampon in really easily and crack on. And that was so not what was happening to me. So I was diagnosed with vaginismus when I was about 20, so that was about 6 years ago. And so I finally had a word for this thing, and that I'd been experiencing since I was 13. I finally had word for it, but all I felt was real anger, because I had this diagnosis, I had a word for what I was experiencing, but I still didn't get it. I still had no information. I didn't understand what my diagnosis was. Unfortunately, my doctor didn't really seem to understand the condition either, and so he wasn't really able to inform me of what to do next and what treatments were available to me. And he basically sent me away and said, you need to buy these dilators, and off you go. And that was as much guidance as I had for a really long time. So the years went by of just trying and failing, I would say in inverted commas now, to have penetrative sex, feeling useless, blaming myself, always apologizing for myself as well in like sexual situations, and even, to a point of feeling like I have to make up for it, like, oh, I can't have penetrative sex, so what can I do that makes having sex with me enjoyable? Because clearly if I can't have penetrative sex, then why is anyone going to want to have sex with me? So I've had various treatments over those years, and I got to a bit of a sort of desperate moment really, where I had Botox surgery. I've spoken a lot about that, and I can answer questions about that, but I was just in this desperate place of just wanting to fix myself. I just wanted to be fixed. And it was sort of after the Botox really that I then found an online community. I was so sick of not being able to talk to anyone about this, feeling like I was the only person in the whole world, and believing that I was, really not knowing that the community was there. And finding that community changed everything for me. It changed the game, and I could finally talk about what I was experiencing to people who were like, oh my god, same, like, and having practically identical experiences. We were able to share like treatment advice. My mind was blown with all these options that I had that I wasn't informed of. But I will say the best change of all, with finding a community, was my mindset and my how I felt, my beliefs about vaginismus, and therefore what that meant about me. And I've learned everything that sex can be, beyond penetrative sex, and that just really has helped me more than I can emphasize, that sex can be pleasurable and joyful and safe and understanding, and that's everything that now I value so much about sex, far more than I could ever value being able to have penetrative sex. So I no longer apologize for myself. I'm not broken, I'm not rubbish, and I'm more confident in expressing my needs now, and what works for me and what I need in sex and what I want sex to be. So I still have vaginismus. I still have it. I'm still, in my own pace, in my own time, figuring it out. But I'm no longer angry. I'm no longer upset. It's no longer sort of a horrible journey that I'm on. It's become quite the opposite of that. So that's why I'm so passionate about talking about this, and why I just love events like this, because I really believe, there's so much to do in terms of like medical research and funding and sex education, that I could talk about sex education for about 4 days alone. But yeah, so I feel like events like this are really helping to make progress in all of those things. So yeah, thank you to everyone here and everyone who organised this. And yeah, I'm personally really grateful for it as well. So yeah.
Thank you so much, Rosie, for sharing, and thank you for what you said. We'll be moving on to our last speaker, which is Lydia Louise. Lydia Louise is 25-year-old. She lives in England, and she's super passionate about women's health. She was diagnosed with vulvodynia, endometriosis, vulvar dermatitis, and chronic thrush. And she shares her journey on Instagram to educate, connect, and learn from others on her account that is called Vulvodynia. She also runs a small support group for women with vulvodynia and other health conditions. So we cannot wait to hear your story, Lydia Louise.
So yeah, it's really great to talk to you all. So I'm Lydia, or Lydia Louise, and I live in a city called Norwich in England. So I have diagnosis of vulvodynia, endometriosis, vulvar dermatitis, and I've also struggled with trying to get rid of thrush for quite some time. My journey's definitely been difficult. It's definitely been one of the hardest things that I've ever learned to manage, and also learn to accept as well. But saying all this, I suppose the hard question is, would I change it? And to people from the outside looking in, they may say, what an odd question. Of course, why wouldn't you want to change it? Why wouldn't you want to live pain-free? Why wouldn't you want to, you know, get rid of all the anxiety around it? However, a big part of me says no, because I have met some amazing people in the last 7 years. I have learned so much about my vagina, about my vulva, and I can honestly say 100% that I have learned to love and appreciate my vulva more now than I ever did before I had any of these physical health problems. So it's definitely a difficult question, and I imagine that a lot of you have also felt the same at some time. I didn't quite know what to talk about originally when I was asked, and to say I was nervous is an understatement because I haven't spoke like this before. I do run a small support group, but you're talking a maximum of 20 people. I do have a social media where I share a lot, but I think we all know how social media can be slightly different, because in a way you are behind the screen and you know, not necessarily talking to people face to face. But what I thought I'd speak to you about is how living with vulvodynia has impacted my life, and I could list a whole range of, you know, ways it's impacted it. You know, my sexual relationship with my partner, my ability to carefree go out to the spa, go out swimming with friends, you know, my ability to go out with my boyfriend for a nice meal and not have to get up 20 times to go to the bathroom. But there's one way in which vulvodynia has affected me, which to some people might be slightly odd, but I thought that's what I'm going to talk about today. And that way is my love of fashion and my ability to wear clothes that I love. So when I was first diagnosed with vulvodynia, things weren't, or my pain wasn't at the highest it's been. And over the years, my pain got worse, my discomfort got worse. And with that, my fashion changed. And people might think, well, that's odd. But I'm sure a lot of you know and can appreciate that actually that's quite normal, because the ability to wear the clothes that you love and the clothes that you enjoy can change. So out the window went jeans. There was no more jeans. Out the window went bodysuits and play suits and jumpsuits and nice underwear. And in came baggy trousers, white cotton knickers, and so forth. We all know how it goes. And that was something that was a really big thing for me, because I loved an evening of putting together outfits and wearing bright, bold colours, and what some people would probably think is quite some crazy garments. So this is just a really small way in which living with vulvodynia has changed my life. However, through learning about myself and the things that work best for me, through meeting all these amazing people, through running my page, through running my support group, I fell in love with fashion again. And I fell in love with fashion again because I have learned from everyone. I've learned and been sent links of cotton underwear that are comfortable for me, but that I still feel sexy in. I have been sent leggings that are still uncomfortable in, and they don't ride all the way up, and I can still wear them, and I can still feel good, and I can still enjoy them. And it's by the community that I've made that's helped me to not only regain my love of fashion, but supported me in all the other things, supported me in my sexual relationship with my boyfriend, and learning that sex doesn't have to be penetrative always. Learning what therapies have been beneficial to people, talking to people about how they're feeling, and really connect with them, and have a group of people that I think truly understand you. So I'm going to leave it there because I know there's some panel questions coming up, and I look forward to kind of talking a bit more about my, being diagnosed, and some advice that has certainly helped me along the way, and continues to help me. I'm still continuing to experience pain, but advice and things that I have learned in order to help me manage and accept it. So I just want to say thank you so much. And yeah, I'm looking forward to the panel questions.
Thank you so much, Lydia Louise. And I have to say that, personally speaking, I really relate to the clothes thing. And it wasn't easy to say goodbye to my favorite trousers or bodysuits or whatever. So thank you so much for bringing that up. So I think that now it's time for our panel. We have a few questions that I'm going to show you now. The first one would be, what do you think about the shame and stigma around vulva and vaginal health? And maybe if you can, you will relate it to your personal diagnosis. So I would start with Michelle, if you want to start.
Yeah, so what do I think about it? Well, I think it needs to go, as we all, I'm sure, can agree. Because if we don't talk about it, there's so many of us out there that will continue to feel the shame and continue to suffer in silence without really advocating for themselves to get the care that they deserve. Or they won't know where to turn to for management or help. Yeah, in regards to my own experience is the shame that came with this really affected my my confidence. I never really noticed it until my late 20s, and really started to understand what was happening in my body, and really took a stand in looking at why, looking a little bit deeper into my pelvic health. So looking back at my experiences, there was a lot of shame, and I feel that by us talking about it, just having these conversations and having these experiences accessible for people is really important, because if I knew going into my doctors, if I could stand up for myself and explain and talk about my vulva the way I talk about it today, I do think a shift would have happened a lot sooner. I do believe there's change happening. We talk a lot about the negative side of this, but since I started the Happy Pelvis and connecting with so many of you, and learning that there are doctors out there who are dedicating their education and their time to help us, that's also going to help reduce that shame and stigma as well, is having more accessible doctors talking about it. And I'm sure, like many of you have seen online, there are some doctors going on Instagram, going on Facebook, going on Twitter, which I think is really awesome and is helping the accessibility of information and education.
Thank you so much. Junan, do you want to build on that?
So yeah, I think the shame and stigma, for me personally, it's been like a really big journey, because obviously my diagnosis doesn't affect just me physically, but me mentally. And there's already a shame and stigma about mental health, especially amongst people of color. And so I think when we start to talk and start to raise awareness, it kind of lessens. What I've learned is, since talking about my experience with polycystic ovarian syndrome, I don't feel so shameful, and I don't see a stigma as much anymore, because I found like my community kind of uplifts me to talk about like what I'm going through. And so in regards to shame and stigma, I think the more you speak about your experience and the more you storytell and the more you share, the stigma lessens. So yeah.
Sorry, can I chime in there? I really agree. Am I on mute? No. I really agree that storytelling has a huge impact. I actually did my thesis on storytelling, so this really resonates with me. Yeah, and having that community there, like you said, right now that shame and stigma isn't there as strong as it was 15 years ago. So yeah, storytelling and having these experiences are really awesome.
Thank you. And I also very agree on that. And I think that also Noah agrees on the storytelling part.
Yeah, I think that the way that I often think about shame and stigma is that the only reason we still have stigma and shame on these conditions is because vulvovaginal pain and pelvic pain haven't had the kind of patient advocacy movements that a lot of other conditions have had to destigmatize them. I was talking to a woman who's used to be very involved in breast cancer advocacy, and she, like in the 90s, and I was telling her my story and talking about my experience, and she was like, word for word, everything you're saying sounds like the way that we thought about breast cancer in the 80s and 90s. Like saying the word breast and saying the word cancer and then saying them together, like that seemed like something impossible to do. And it seemed like something you could never, ever talk about. And now, of course, like, I mean, maybe this isn't true everywhere, but for the most part, I think anyone can say like, oh yeah, this person has breast cancer. Like we know what that means. We know what that looks like and what that experience is like. And that's thanks to like incredible activists and advocates who changed it. And I think that with vulvovaginal pain and pelvic pain and all these conditions, we haven't had that yet. Like we haven't had that movement of people like the way abortion access has had, the way that breast cancer, AIDS, mental health, many mental health conditions. And that to me is what's so exciting about a lot of this work, is that if we actually, like, we could live in a world like 20 years from now, 30 years from now, where the idea that you would say like, I have vulvodynia or I have vulvovaginal pain would be like, oh yeah, okay, just like, I don't know, chronic jaw pain or knee pain or anything else. Like that's not a big deal. And that I think would like radically change how people experience their condition.
I totally agree. Is anyone from our panel wants to add something on this?
I would love to just say that like the shame and stigma, it feels so when you do meet other people and when you do have these kinds of conversations, it feels so unnecessary and just like a big waste of all of our energy, because we don't need to be ashamed. You know, we're having a perfectly like normal experience, and yeah, I just really want to say that it's so unnecessary. We don't, I wish that I hadn't had to feel all of that, because it feels really painful. Shame feels really, really, really heavy and really painful. And yeah, I wish that all of us didn't have to experience that. Yeah.
I completely agree on that. And as we are a little bit shorter on time, I think we're going to go to the next question. And I'm going to ask Lydia to answer. How can the medical community be more supportive?
I think that one of the main things is listening more. Because, you know, it really resonated with me when one of the other speakers mentioned about how, you know, oh, who am I to challenge a doctor? And, you know, and they found their voice, and well, we are the patient, so we know what's going on with our body, we know what's going on with us, and it's really important for the medical community, I think, to just listen a little bit more. And it's not necessarily a criticism, because I have had a lot of actually positive conversations with medical professionals before, and who have really been helpful and have really listened, but I've also had that where it hasn't been the case. So I think that listening a lot more is really helpful, and just I think getting a bit more of a background history is also can be really beneficial as well.
Thank you so much for sharing. Keisha, do you want to add something about it?
Yeah, I totally agree. The listening part is like number one on the list. I feel like a lot of times we go to doctors or specialists, and when you have something like pelvic pain or things that are not as common, it's easy for them to kind of just look at the surface level and push you to the side, which is where I feel like where things go wrong, because I feel like a lot of doctors and people that you see, they're not willing, it feels like anyway, they're not willing to go deep enough to really get to what the problem actually could be, or what they can really do to help you. Like I mentioned before, I've been fobbed off so many times, and you get to the point where you're just like, you want to scream and roll on the floor and cry and just shout, like, help me, like, what are you doing? But, you know, I think the listening part is like the key thing, because without that, you're just both going to be sitting there. I'm talking at you, you're not listening. And then what happens? I'm just left in limbo again. So I definitely agree. Listening is like, it sounds so simple, but it's so key. And I feel like that's where we're missing a lot of help and support for people going through the things that we're all going through. So yeah, that's what I'd say as well. I definitely agree.
Thank you so much, Keisha. Michelle, do you want to add something?
Yes, I'd also like to add is if your practitioner, your healthcare provider doesn't know the answer, they should have the ability to refer out and try to help you find the right practitioner for your care. I just know that I spent way too many years in my family doctor's office when I know I could have been sent out to see other specialists. So also, if your doctor isn't listening to you and you are feeling that, maybe at the end of the conversation, you can ask if there's any other doctors in this area or field that can help.
I just wanted to jump in quickly just to add on that, if that's okay.
Of course.
I just think that's such a key piece of information, because I have so much respect for a medical professional who is going to tell me that they don't have the answer. That's okay. Not everyone knows everything. I don't have the answer. But are you going to help me get to where I need to get to? Are you going to help me find the answer? And that's the key bit I just wanted to add in there, because I thought that was really great.
And also, if I can just jump in and say something as well, adding on to both answers, like, I think, like was previously said, if you get to a point where the doctor's saying to you, well, I'm not going to either A, I'm not going to help you, or B, I don't know how to help you. I think that's where sometimes you kind of have to bring your research with you, like I said before. Because, for example, I've been going through pelvic pain since I was 22. I'm now nearly 30. I just found out last year what a pelvic floor physio was. I had no idea. And that was from actually the Happy Pelvis talking about it and somebody else. And I thought, oh my God, I've never heard of this before. This is ridiculous. And then I was able to go to my doctor and say, listen, buddy, I don't care what you have to say. You need to put me onto who I need to know to see a pelvic floor physio. Because if I hadn't have done that, I would have been left not getting this extra help that I wish I had 8, 7, 6 years ago. So yeah, I just wanted to say that as well.
Thank you so much for sharing, and how amazing is that you have helped each other with your journey and now you're sharing the same panel. I'm really, really happy and proud about it. Okay, maybe we can move on to the third question that we have. And I think we have a lot to say about it. Have you been able to connect with other people with the same or similar conditions? So maybe we can start with Rosie.
Yeah, I was going to say, I don't mind kicking this one off. Yeah, because like I said earlier, it's just been such a game changer for me. You know, on the topic of being able to advocate for yourself, like that's something I just couldn't do when I was 20 because I didn't have any information. I didn't know what options were there, and finding a community has really helped me to do that. And I know that if I was to go back into that appointment now, 6 years later, with the community behind me that I have, I would just, you know, really be able to put my foot down and really be able to say, actually, no, I know that this is available. I know that I can have physiotherapy. I know that I can have psychosexual therapy. Yeah, as this person's just said, information is so vital, and that's why community has been so amazing. And also what I love about it so much is watching people just share experiences with each other and share something that they've found helpful, even if that's a practical thing, or if that's just like a piece of a quote or whatever it is. Like yeah, I find that really inspiring and so helpful. So yeah, I just think community is absolutely everything, and it stops us all from feeling alone, as I'm sure we all have at some point.
Yes, I think that everyone has felt alone, has felt like a unicorn, as Keisha was saying before. And just Googling or finding some people on Instagram has been crucial for me. I think it has been crucial for a lot of people experience the same symptoms. Noah, do you want to add something?
Yeah, so I mean, once I started telling people and finding all these different people, I, along with some of the other people who I met who also have vulvovaginal and pelvic pain, started Tightlip, which started as a podcast, really just to create a platform to talk about personal experiences with pelvic floor dysfunction and vaginal pain, and also to talk about some of these like much deeper social and political problems with how they're treated. And now we're expanding to become an advocacy organization and do more work that's like patient-led advocacy to change how we're treated by the healthcare system. I honestly, at this point, feel like it's rare that I meet someone or find someone who doesn't have one of these conditions. I feel like it's just like everywhere. Once you're talking about it, it's like every single person either like knows somebody, or if they don't have it now, they might have it in like 2 to 3 years. I've like definitely had friends who have developed, unfortunately, vaginal pain like while I've been in my experience. And so at this point, I kind of feel like I'm surprised when someone doesn't have some version of one of these conditions, because they're just so common. And I have found a lot of that it's both like drastically changed my experience to meet all of these people, and also has like, just for people who don't necessarily have a diagnosis yet, it can really change for someone to like hear about what you're going through and hear about what you're experiencing. That could actually help them have less pain, because if you go years and years and years without getting a diagnosis, your pain, I mean, there's a lot to say about how chronic pain forms, but if you're going for years and you don't have a diagnosis and you don't have any treatment, I mean, I wonder if my entire life would have been different if when I was a teenager, I had like gone to a pelvic floor physical therapist. Maybe I would not have this condition now. And so I really think like talking to people and finding other people can actually cut down on how long it takes someone to get a diagnosis, to get treatment, and then how much time they actually spend in pain.
Thank you so much for sharing, Noah. Junan, do you have anything else in this topic?
Yeah, I do, because this topic is quite important. If I didn't find my community, my PCOS community, I wouldn't have the confidence to speak. I wouldn't have the confidence to speak here today. I wouldn't have the confidence to speak to my own family about what I've been going through. And what I've noticed is the more you speak about it, the more, I think one of the speakers just mentioned, the more you speak about it, the more common it is. So I remember someone publishing an article about my story, and not knowing my next door neighbor who lives like 5 doors down the road from me is going through the same thing, has PCOS. So a community can give you confidence to speak your truth. A community can give you confidence to advocate for yourself, because like you said, information is vital, but also how to kind of talk to medical consultants and doctors. I remember when I was first diagnosed, I just walked out the doctor's surgery and I was like, okay, what am I supposed to do now? If I had known the things that I know now, that wouldn't happen. At this moment in time, the way I advocate for myself, my doctor hates me. I'm just like on his back. And I think the community has definitely given me that confidence to be on my doctor's back and given me the information I need to be on my doctor's back. So yeah, I think if you find your tribe and you find your community, it will definitely give you so much confidence in your own personal life, in your medical life, and even your own working life and day-to-day life, dealing with this chronic illness. So yeah.
Thank you so much for sharing. I think that we covered the last question that I had, that was about giving advice to people with these conditions, with everything that you have said. So I really thank you again. Yeah, Michelle, please.
Sorry, there was just one more with that question. I just wanted to point out that might be helpful for some of the viewers, is if you're going to your appointments alone and you're not feeling validated by your doctor, bringing a support person can really help validate your pain experience with your support person there. It can be impactful for you. It could be also impactful for your support person to know how to better support you. So that is another little tip and trick, is bringing another person to your appointments so they can understand what's going on.
I completely agree. And it's super important to have the courage and also have the support for when going to medical appointments. It can be very hard. And also to pelvic floor PT. I've read some questions about it in the chat. So thank you so much again, everyone, for answering my questions. And I think I'm gonna pass it to Gemma, which is our amazing chair of the events team of Medical Herstory, and she's gonna guide you through a little Q&A in which you can ask your questions.
Yeah, so we've had some amazing questions coming in the Q&A. I don't think we're gonna have time to go through all of them, but we'll try to get through some that were the most popular. So the first one is specific to Keisha and June Ann. So a couple of people were wondering how race has factored into your interactions with doctors, such as disbelief about your condition, and if you found that it was more helpful to meet with a doctor that looked like you as well. So maybe June Ann, you can start us off.
So with me, funnily enough, my diagnosis story, my doctor wasn't the same colour as me. However, I specifically chose that doctor because I know that I would get the care that I wanted. So throughout my kind of experience dealing with like doctors, I would honestly say it hasn't been positive. Race does play a factor. I know there is a back kind of condition where Black women are seen as they can handle pain. And we know that derives from slavery in America, where the father of gynecology had female slaves and did horrendous experiments with them. So, and that kind of trickles down, institutionalizing now. I'm in the UK, and it does institutionalize in the NHS system, the public health system that we've got over here. So yeah, it has impacted, but what I've noted is that once I have my information to advocate, and once I have my notes, once I have my my information, like I've got all my symptoms written down, how often, how heavy is my bleeding, so forth and so forth, my doctor can't say that he didn't have the information. And I've also learned a trick where if my doctor is refusing to help me or to support me, I say put it in my notes. Because I've learned that if they don't want that in their notes, because they don't want the backlash, right? So that's why my doctor hates me as well. So I always say, well, put it in my notes that you're not going to help me. And then obviously they backtrack. So yeah, I've had bad dealings with doctors, I think, but now knowing how to advocate for myself, it has been much more easier.
Amazing. Thank you so much. Keisha, did you want to add anything onto that?
Everything Junan said is literally tick, tick, tick for every single thing. I'm in the UK as well, so my experience is identical. And for me, it's like she said, the whole, you're seen as a Black woman, you're strong, you're tough. And when you're telling them these things, I'm in this much pain, oh, she's just complaining, she's being extra or whatever. So the same thing, that's why I go to my appointments equipped, ready for war. Like I said before, with my questions, my symptoms, anything you say to me, I'm ready to fire back at you. And like her as well, my doctor absolutely hates the hell out of me, and I don't care. I've just gotten to the point where it's like, one of the last doctor's appointments I had, he said to me, well, there's nothing I can do to help you. And just sat there staring at me. So I sat there staring for a long time, and I said, no, you're going to help me. So let's figure something out, because I'm not leaving here until you give me an answer or you point me to somebody else. So yeah, I can't add much more to what Junan said, because it's literally identical. So yeah, race plays a factor, but again, it's just a matter of building the confidence and, just feeling confident, advocating for yourself, and just have the information to back up what you're saying, so they can't turn around and say to you, well, oh, I don't believe you, or maybe it's just in your head, or whatever the crap they try to tell us. So yeah, that's what I'd add. Not much more, but yeah, the same in different words.
Yeah, thank you so much. That's amazing. I think that both of you have the confidence to be able to advocate for yourselves and make sure you get the treatment that you deserve. And before we move on to the next question, I know Tori put this in the chat, but reminder to everyone to stick around until after the Q&A, because we have some amazing giveaways. So our next question is specific for Rosie. They thanked you for sharing your story and also mentioned that they had been diagnosed with vaginismus and the progress has been very slow. So they're wondering how you deal with an unknown timeline for recovery.
That's a really good question. I used to really struggle with that, because I mean, when I first got my diagnosis 6 years ago, if you'd have said to me that in 6 years I would still have vaginismus, I would have been really angry and really upset. And actually, what I realized was putting all this pressure on a timeline was actually only making it worse. Vaginismus, and I'm sure lots of other similar conditions, it thrives off of pressure. The more anxious I feel, the more I hold myself to a particular standard or a particular timeline, the worse I feel and the worse my vaginismus actually gets. And so I found that in order just to get by, I had to come to terms with the fact that I don't know when this might come to an end. Maybe it never will, I don't know. But relieving myself of that pressure was so important for me to be able to just get through it, like for me to be able to move forward. It was vital that I did that for myself. And actually sometimes I think, like, give yourself a break. Like, you're, you know, all of these conditions that we're talking about, like, they're so hard sometimes, and I know for sure that I've put myself under so much pressure over the years to, like, you know, be always working on it and constantly be like making progress and all of this, and you know, whilst making progress is great, even that sometimes feels like I need to give myself a break. And so yeah, I hope that answers the question. That's how I've had to deal with it, I think, in order to move forward. And I feel better now. Like, it's not that I've just sort of had to change my mindset like that, and that's made it worse. It's made it better. If I'm on this journey, I'm on this path anyway. So if I can make it less miserable for myself, then that's what I want to do. So yeah, I hope that answers the question.
For sure. Thank you so much. I think it can definitely be challenging when you put the pressure on yourself, but just accepting your journey is a big step. So we only have time for one more question. This is going to be our last Q&A question, and anyone can jump in to answer if you have any thoughts. So the question is, can you touch on how gender identity and cis normativity might further shame and stigma around vulva and vaginal health? So anyone can jump in and answer if you have thoughts. Maybe we'll start with Noah, if you have anything to add.
Yeah, I can go. I feel like this actually relates to the question that was just asked in some ways, because I think part of what people struggle with, and I've also, vaginismus has been one of my many diagnoses, but like one of the challenges with, I think in particular, pain with sex, this is this idea that like the cure or the solution is that you can like have penetrative sex, like the idea that like that's the ultimate goal is like pain-free penetrative sex. I think the pain-free part, definitely the ultimate goal, but the idea, and Rosie was talking about this earlier on the call, the idea that like what we're all working towards as if you're like a cis heterosexual person is penetrative sex. I think everything has changed for me in my relationship to my condition since like fundamentally challenging that idea that like that's what I'm working towards, and that also that's sex. Like, I think I am now very consciously, like, whenever I talk about sex with anyone, I use penetrative sex if I'm talking about that type of sex, and I use sex if I'm talking about anything else. And I think just like having a shift in how you understand what is sex, why is that the goal, who is that for, like, who, I think there's like a lot to really question, and like is that a goal that you want for yourself, which is like totally okay, right? Like if that's something that you want for yourself, great. But I think that like actually trying out and playing with like different understandings of like what sex is and what it should be and what a goal is or what you're actually working towards feels like a very important part of, for anyone who has any of these conditions where it like impacts your sex life.
For sure. Thank you so much. Lydia Louise, do you want to add anything to that?
Yeah, this is more, I guess, a bit of an advice, but I just wanted to add it on to the end of that, really, that I definitely previously had the idea that sex was, you know, penetrative. I guess that's what I grew up being told, right? That's what I understood it, and it really actually wasn't until I started doing something called psychosexual therapy, where I really understood and got to understand that that's not the case. So yeah, it's just a bit more of an advice, really, that for me personally with Vulvodynia, psychosexual therapy was something that that I'm currently doing. It's something that is helping me. It's no quick fix, you know, and it can seem like a lot of work, but it's something that has helped me a lot with understanding what do I want, what my goals are, or what is society's goals trying to push onto me with regards to sex and what society thinks sex is. So yeah.
Thank you so much for all of those answers, everyone. I think they were really insightful. And since we're low on time, we're gonna go into our giveaways now. So I'll pass it over to Marlow and they can tell us a bit more about their products.
Hi, everyone. I just wanted to say thank you, first of all, to all the speakers for sharing your stories. I think a lot of similar experiences where you're dealing with conditions that are stigmatized, where there's not a lot of visibility around what you're going through, and where getting a condition or getting a diagnosis around your condition itself is really incredibly hard sometimes. So having this storytelling element with everyone and being able to share your stories, I think is so impactful, and kind of like something we have the most control over in our lives is being able to create that personal impact. So just really thankful for all of you and being able to share your story. I'll go quickly into a little explanation about our product as well. As Nadia, my co-founder, mentioned, we just last month launched the first ever lubricant and tampon kit designed to be used together. And we really had a lot of people in mind when we were designing this product. So whether it's someone who has general anxiety using tampons or vaginal dryness, or maybe it's their first time using it, or it's someone, you know, who has vaginismus, you're actively undergoing dilation therapy and you're looking to try out using tampons again. So this is, I have some with me here. This is our product itself. We have the lubricant bottle and it's got a valve at the top. I don't know if you can see it too well on Zoom, but it is designed so that you can just dip your tampon in. It's one dip, it evenly coats it, and it's really mess free. And that, especially as Nadia mentioned, a doctor told us a solution would be to spit on your tampon, which didn't really cut it for us personally. Or you have your kind of squeeze bottle options, but that turns into a bit of a messy arts and craft process in the bathroom. So we're really excited about this product. The lubricant is water-based, pH balanced. Tampons are organic cotton and they're free of fragrance and dyes and anything irritating like that. So yeah, we're really excited. I will share we have a coupon code for you all as well if you want to try anything out. I'll share that in the chat. You can use the code or just click on the link directly. We do currently only ship to Canada. So if you're outside of Canada, honestly, just send us a DM on Instagram and I'll keep you looped in with any expansions. I know we're planning on starting to sell in the US soon. But yeah, we're really excited seeing the impact with our product already, kind of helping people be able to use tampons as well. And also just really inspired by all the speakers today and medical Herstory's work in this space. It's really, really important stuff. So thank you, everyone. And feel free to send us any questions on Instagram or in the chat if you want to know anything.
Amazing. So that brings us to the end of the event today. I'm going to announce our winners in the chat. So we have Marlow's amazing product, which I'm definitely going to be ordering. We have a Smile Makers vibrator, which you can see here. And then we also have a bunch of medical Herstory merch. So I just put those in the chat. So if you just want to message me afterwards, we will get to your prizes. And again, the biggest thank you to all of our speakers. And we have one closing slide for you all. So we just want to know your key takeaways. You can put these in the chat. Like Alessia said, you can put these on your post-it note for the week, on your Instagram, tag us, let us know. But what is one thing that you'll be taking away from this event? I know for me personally, there was so many great advice. Key takeaways, just, not feeling alone in so many things that I hadn't even considered, from clothing to trying to advocate for yourself, to finding those communities and the power that we all have there. So definitely let us know in the chat. And then we're going to be sending around a resource package afterwards with all of our speakers, social media, their podcasts, the things they've been working on, so you can learn more about these health conditions, as well as medical Herstory resources. So thank you again so much, everybody. I hope you're enjoying reading those chats. I'm seeing a lot of validation, a lot of, self-advocacy is key, that we're not alone. So everyone have a fantastic rest of your day, and definitely stay tuned to hear more from Medical Herstory.